to Cram with Camila, where we cram for the RD exam. Let's talk about cardiovascular diseases. Hypertension may be classified as having a systolic blood pressure greater than 130, a diastolic greater than 80, or both. And as you may know, the optimal blood pressure will be about 120/80. Risk factors include age, race, family history, inactivity, tobacco use, a high sodium consumption and a low potassium consumption, drinking too much alcohol, stress, and certain health conditions such as kidney disease. Hypertension may be primary or secondary. Primary hypertension develops over time. Secondary hypertension is due to other conditions, for example, kidney disease or a thyroid issue. Hypertension may be classified in stages, so you might have stage 1 hypertension, stage 2 hypertension, and that will determine the risk of developing coronary heart disease. It's important to know that obesity is a major risk factor for developing hypertension. Hypertension may be treated with diuretics such as thiazide, but it's important to know that that could lead to hypokalemia. We may be asked on a test about modifiable risk factors for hypertension, and there are 4 that we should remember. They include alcohol consumption, physical inactivity, high sodium intake, as well as being overweight or obese. People that have hypertension may benefit from the DASH diet or the Mediterranean diet. The DASH diet stands for Dietary Approaches to Stop Hypertension. The DASH diet includes a lot of fruits and vegetables, as well as whole grains, dairy, poultry, limited alcohol. When it comes to the Mediterranean diet, it focuses on consuming alpha-linoleic acid, monounsaturated fats, so think olive oil, fatty fish, nuts such as pistachios and almonds, walnuts. The Mediterranean diet also promotes a high consumption of fruits and vegetables and consumption of resveratrol, which is found in the skin of red grapes. Atherosclerosis refers to a buildup of fat, cholesterol, or other substances that lead to a plaque. So what happens is the arteries that carry blood flow to your body become thick and stiff. Smoking, insulin resistance, diabetes, hypertension, and high cholesterol can all lead to atherosclerosis. Other risk factors include family history, lack of exercise, and of course, an unhealthy diet. Complications associated with atherosclerosis include coronary artery disease, carotid artery disease, peripheral artery disease, aneurysms, chronic kidney disease. Patients that have atherosclerosis may be given heparin, which is a blood thinner. Basically, it's an anticoagulant to help reduce the risk of developing blood clots. Atherosclerosis may lead to ischemia, which is a reduction of blood flow. Now, if the blood flow is reduced to your heart, that's called myocardial ischemia. Myocardial ischemia, which is also known as cardiac ischemia, reduces the heart muscle's ability to pump blood. When blood flow to the heart is blocked, that can lead to a heart attack or myocardial infarction. So sometimes plaque can rupture, and what happens is that's going to block blood flow. That can lead to a destruction of a part of the heart muscle. This lipidemia is having an abnormal level of lipids. That could be high or low. So for example, if you have abnormally high triglyceride levels or LDL levels and abnormally low HDL levels that will be considered dyslipidemia. The National Institute of Health defines metabolic syndrome as having 3 or more of the following conditions: high triglyceride levels, reduced HDL cholesterol, elevated fasting blood sugar, increased blood pressure, or large waist. Heart failure can happen when your heart is unable to meet your body's demand for blood and nutrients. So think about this. If your heart becomes weak due to coronary artery disease or perhaps due to hypertension, that can cause the heart to not pump efficiently. Some symptoms would include shortness of breath, dyspnea, also fatigue, weakness. There might be edema, as well as irregular heartbeat, swelling of the abdomen, ascites, lack of appetite, nausea. Left-sided heart failure can lead to fluid backup in the lungs, and right-sided heart failure can lead to fluid backup in the abdomen, as well as the legs and feet, causing swelling. Left-sided heart failure can be systolic or diastolic. Systolic heart failure would be if your heart cannot contract appropriately during systole. Meanwhile, diastolic heart failure would be when your heart cannot relax during diastole. Complications associated with heart failure include kidney and liver damage, as well as heart valve problems and heart rhythm problems. Because there will be reduced blood flow to the kidneys will try to compensate for this by secreting hormones. It's going to lead your body to retain sodium. So the sodium retention is going to lead to fluid retention and therefore weight gain. Heart failure patients will be advised to monitor their sodium intake and therefore could benefit from the DASH diet. Heart failure may lead to weakness, inability to eat, perhaps poor appetite. Therefore, a lot of patients will develop cardiac cachexia. Digitalis might be given to patients as a treatment. If a patient is given a loop diuretic, thiamine may be lost, and therefore thiamine levels need to be monitored.